Hi, I'm Heather McLean, and this is Heather's Health Talk, and today I'm going to be interviewing Dr. Jennifer Highland, and she is an osteopathic physician in Plymouth, New Hampshire. And we are going to sort of explore the world of cranial osteopathy. And most people don't know what that is. I did not until I married an osteopath, Dr. Jeffrey Greenfield. And so Jennifer and Jeff are colleagues and practice similar I guess, techniques. So what we're going to do is we're going to sort of start with what osteopathy is and let Jen explain it all. That's a big topic.
Yeah, it depends how much rain you want to give me. I can go on for quite a while about it. But I'll start with just the basics. A lot of people don't realize that there's actually two kinds of fully licensed physicians in the United States. Those with a DO degree, or Doctor of Osteopathy, which is my degree, and those with an MD, or Doctor of Medicine degree, which most people are a little more familiar with.
Yes, much more.
But they're essentially parallel training processes.
Okay.
And so, like an MD, I start with an undergraduate degree and then apply to medical school. I had to take the MCATs and the same entrance exam. And then it's a 4-year medical school. And in many ways it's very similar. We have a lot of the same study topics: anatomy, physiology, pharmacology, pathology, nutrition, things like that. But the approach is a little bit different in terms of how they're taught. There's just a little bit different focus, and I would characterize that most as an emphasis on the interrelationships between the different body systems and how the person functions more as a dynamic whole. And right. I can talk more about there's specific principles or a philosophy that osteopathy is based on that echoes that. But so we learn more about how the different systems of the body influence each other in health and disease. And in particular, there's a bit more emphasis on the musculoskeletal system, or the body structure, as a way of accessing body function, because we learn how those two integrally influence each other. Body structure influences body function, and vice versa.
Oh, that's important.
And so we actually learn to use our hands from basically the first week of medical school to diagnose the body structure, and then we learn hands-on techniques or approaches with which to, as we refer to it as, manipulate or work with enhancing motion and health in the body structure as essentially a handle to improve the function or the physiology of the body. So in a nutshell, that's how I would say the undergraduate training differs. After we finish our 4 years of schooling, and of those, 2 years are in the classroom and 2 years are doing what we call rotations or externships out in the hospital, where we go through all the different medical specialties and kind of get a taste of it, and essentially hands-on learning.
And that's a hard 2 years, isn't it?
It's challenging.
Yeah.
And but it's a fantastic way to really learn how to take all of the things you learned in the classroom and put them into practice and see how that all makes practical sense, because they're two very different ways of learning. So that's where it all comes together. And then after that, just like with an MD degree, we would go out and apply for internship and residency programs, and that lasts anywhere from 3 to 8 years of postgraduate training in the hospital, depending on one's specialty.
Mm-hmm.
Osteopaths are able to go into all of the same medical specialties as MDs. So in fact, in the Plymouth area, we have family practitioners, we have internists, we have orthopedic surgeons, all who have a DO or Doctor of Osteopathy degree. DOs can also be obstetricians and neurosurgeons, but we do have one specialty that's unique to us, and that's my area of specialty, which is osteopathic manipulative medicine.
Okay.
which is essentially spending 3 years postgraduate intensively studying in a hospital clinical situation how to apply those principles that we learned in school of using our hands to improve function and health in a full range of medical patients.
So this is a very hands-on approach, and it's a very holistic approach. And what you're doing is you're actually almost, would it be, the good word be like palpating, feeling different musculature systems, bones and musculature, and then organs?
So palpation, or the art of skilled feeling, essentially, learning skilled touch is where we start. So we use palpation or touch to make a diagnosis. And initially, as a student, the easiest thing to feel are bones and muscles and big things close to the surface. So that's where you start. And in fact, the term osteopathy often causes a lot of confusion because people think osteo, that means bone. It's all about bones, right?
That's right.
And osteopathy certainly includes study of and treatment of the bones, but it's much more than that. So Dr. Still, Andrew Taylor Still, who was the founder of our profession, or as he preferred to call it, the discoverer of osteopathy, because he believed that osteopathy is based on fundamental natural laws, and we can talk more about that too.
Okay.
But he said he chose the term osteopathy because, as he said, because we start with the bones. And which was kind of my experience in medical school, but that's by no means where we stop. So oftentimes we might use the bones as convenient handles to address strain patterns in the fascia, the connective tissue, the muscles, etc. But we're also learning to feel for tissue fluids. We're 70% water.
Okay.
Give or take, depending on our time of life. So all of the different fluids of the body, intracellular, extracellular, or outside of the cells, fluid in the arteries, in the veins, in the lymphatic drainage system. So we're working with all of those aspects of circulation. We're working with nerve function, and there's even ways that one can get a sense of nerve function through skilled touch or palpation. We're working with metabolic aspects of body function, and there's degrees to which one can learn to sense different aspects of function and healthy function. Tissue texture can have different qualities when, for example, someone's blood sugar is sky high for a period of time. There's kind of
you can kind of feel that.
There's a more thick or viscous feeling to it, or quality to it, and so we can actually learn, and historically in the schools, osteopaths have been asked to learn to feel metabolic qualities and aspects of metabolic health. So the bones is kind of a very limited way of thinking about osteopathy, but unfortunately our name, we couldn't come up with a name that was comprehensive enough probably to include all the different systems of the body to adequately explain.
Just wanted to ask you some of the principles of osteopathy.
So I mentioned that osteopathy is based on a philosophy, which I think makes it rather unique as a form of medicine, that we have several guiding principles that we use as a touchstone. It's not just a collection of techniques and a collection of knowledge. And so there's 4 basic principles. And the first one is that the person is a whole. And that sounds rather intuitive, rather familiar to us now, because the concept of holistic medicine is so ubiquitous now. But back in the 1870s and throughout the early part of the last century, that was a bit more of a radical idea. And so as physicians were looking not just at the body or the disease process, we're looking at the whole person, body, mind, and spirit, and trying to incorporate that concept of wholeness into our entire treatment plan.
So it's beyond just symptom, symptom, symptom.
Exactly.
Okay.
And as part of that also, even just within looking at the body, we're always trying to keep more of a sense of the whole. So for example, if somebody came into me with a stomach problem, rather than simply zeroing in on the gastrointestinal system in terms of my questions and my examination, I'm going to be thinking about the broader picture. So how not only things in my history like lifestyle and diet is an obvious one, but also thinking about the respiratory system, which delivers oxygen to the gastrointestinal system, and also the diaphragm, which is constantly massaging it. And that's important for helping normal function and normal circulation through the digestive system. So looking at the circulatory system also, the nervous system and nervous system balance, autonomic nervous system balance is very important for good gut function. And then also the musculoskeletal system, the container that the digestive system is sitting in, how is that influencing its function? So looking at that whole range of influences. The second principle is that the body is fundamentally self-healing and self-regulating. And for me, that's a really key principle because it means that when somebody comes into my office, I'm not looking at how am I going to fix them.
Right.
I'm instead coming from the assumption that there are natural forces within that person's body that are always trying to move them in a direction of greater health, greater balance. You know, we all know about our immune systems. When we get sick, we generally are able to get over that cold. It might, or illness, it might take longer than we would like, but sooner or later, unless we're immunocompromised, we heal it. If we cut ourselves, we have tissue repair processes that we really take for granted, but when you go to medical school and you start learning about all of these systems, it's really pretty miraculous and extraordinarily well coordinated. And not only that, but there are thousands of other functions that the body is constantly balancing. pH in the bloodstream, sodium concentrations, potassium concentrations, hormone balances, managing blood sugar. And those are just a few examples of all the things that the body is constantly coordinating to keep us healthy. And so my job as an osteopath, when someone comes into me and they're not feeling well in some way, is to look at what those person's own healing resources are and where they're breaking down or where they're becoming limited. And then my job is to try and figure out how I can support that healing process in them better. If there's any barriers that I can remove to their own inherent forces, inherent body forces, managing that problem better. For example, looking at diet and nutrition, workplace ergonomic issues, stress management is always a big one.
That's big.
Things like that. Sometimes it might involve providing a medication, and often it's going to include using my hands to address any imbalances or restrictions in the musculoskeletal system that may be holding the body back in that healing process. So I'm looking at all of those options.
So it's good if a patient is also proactive in their healing.
Absolutely.
Rather than coming to you and saying, fix me.
It's very much a partnership, and that's something that I'm always reminding my patients.
Yes.
Whether things are going well or going poorly, it's all I can accomplish is providing my best to match whatever resources the patient is able to bring in, whether that be their initial state of health and vitality, how they're nourishing themselves. That's something they can often work on. other ways in which they're taking care of themselves, other demands and stresses that they may not be able to avoid, that they have to figure out how to manage. And then also certainly their willingness to take an active part in the healing process.
So this is important because what you're actually seeing are certain lifestyle choices that have an impact on people's health. So you can actually help generate health back into that person, and it's helpful if they recognize some of these lifestyle issues that are actually creating more problems for them.
Absolutely. I mean, it's certainly not essential. There's a lot that I can do to help someone who's just says, I'm maxed out, I'm doing all I can do. And I absolutely respect that.
Right.
Each person is only able to do what they can do at a particular moment. And so my job is to figure out what can they muster. Are there some ways in which I can encourage or guide them to taking on some new healthy habits, or just find a slightly different way of doing something that they're already doing that may better support their health. But also to recognize that if that's not something they're able to take on right now, then we work with what we can.
That's right. Okay, so that's what, 2 principles?
That's the second principle.
Wow, let's move on to the third. Let's see, we got 4 to go. There's a lot here to learn.
So the third principle is that body structure and body function are interrelated, as I mentioned before. So when when there's a problem with the body structure, it's going to have an effect on function, and that can manifest as anything from a short leg causing a limp and a scoliosis, to a limitation in rib movement. It could limit the ability of that portion of the lung to fully inflate. That means there's going to be a little bit more fluid retained there. That can make it a little bit more vulnerable to infection. So those are just a few of the ways that structure and function can influence each other. The reverse is also true. When there's a problem in an organ system, or a problem with function or physiology, as we call it in medicalese, then that will generally show up as clues in the body structure. So irritation or inflammation in an internal organ, for example, can often have a manifestation along the spine in certain areas that we can feel, that relate to the nerves that innervate that particular organ. And so that simply gives us another clue in our diagnostic process. And so my hands can help with my add to my standard physical exam and history, along with listening to the heart and lungs and checking a person's ears. I can also pick up those structural clues also that might help to refine the diagnosis. And then that principle of structure and function being interrelated basically gives us the rationale for the manipulations. So we're using structure as a handle to influence and improve function in whatever ways we can in the body. And the fourth principle really just pulls the other 3 together. It says that a rational approach to treatment is going to incorporate those other 3 principles. And that might seem like kind of an extra or an unnecessary principle, but that to me that's the most important one and the easiest to forget, is that if we're really going to practice osteopathy, then we have to be constantly living and using those other 3 principles in every interaction with our patients in whatever ways we can.
It's no wonder that it takes so many years to become an expert at this. I think now, can we branch off into cranial osteopathy, or osteopathy in the cranial field, correct?
That's the official
term. Official term.
A little confusing, but
maybe you'd like to give us a little bit of an overview of that particular branch. I don't know if you want to talk about Dr. Sutherland or...
Sure. So I tend not to like Dr. Sutherland himself, who was the one who really originated the cranial approach or the who developed some ways of working with the head as well as the rest of the body. He himself was clear all the way along that he didn't see this as a separate form of osteopathy. This was simply a way of expanding those same principles that Dr. Still had originally laid down. But osteopathy as it was originally taught included manipulation of the spine, of the arms, of the legs, of the internal organs, but it left out one important area, and that was the head. And Williams Gardner Sutherland was one of the early students in the osteopathic schools. I believe he graduated in 1901. And while he was a student, an idea got into his head that just never let him go again. And it was an idea after seeing what's called a disarticulated skull, which is a skull where all of the separate bones are separated slightly so that you can see their relationships. And if you've ever touched a baby's head, you'll remember that our skulls don't start out as one big solid ball the way we typically think of it. It's actually made of lots of different bones.
And the plates.
Essentially, yes. And in a baby's head, there's actually spaces between a lot of those plates and the fontanelles, the soft spot, and they gradually grow together to provide a full protection for the brain. But actually, even late in life, if you look at a skull of an older person, you can still see the outlines of where those bones came together, or the so-called sutures. They're essentially like joints. And Dr. Sutherland looked at those joints, and he was struck by the shapes of those different joints and the arrangements. And the thought came into his head that this system looked like it was designed for movement. And he was accustomed to thinking about movement and evaluating movement everywhere else in the body, but even back then, that was a very radical thought, and he basically tried to push it out of his head. But it kind of stuck somewhere in the back of his mind, and I think it was about 20 years later that he finally started pursuing that further, essentially trying to prove to himself that that was impossible. And he started doing experiments on himself. He created all kinds of contraptions using old salad bowls and bandages and breadboards and things like that, and coming up with these gadgets that would fit on his head in particular ways and winding bandages around that he would tighten in particular ways, or sometimes have his wife assist him and see what the effects were. And his premise was, if there's no movement in the head, then I can crank on these all I want and it's not going to make a difference. But what he discovered was that depending on how he applied these pressures, there were very noticeable effects. And fortunately, he was a very observant person, and he was very much aware of his body, so he was able to make incredibly precise observations about what was going on. And the reason he did the experiments on himself was, as he said, that he wanted to have that knowledge for himself, that if he applied these contraptions to somebody else, he would get information, but the patient or the guinea pig would have the actual knowledge of what it felt like from the inside to how those forces applied. So he learned on himself and discovered different ways, not only what happened when he applied certain forces that restricted movement, and sometimes he came out of these things feeling terrible, and it took him days to recover. And so fortunately he was able to start figuring out ways to, techniques to free up those restrictions as well. And so he developed a whole approach to treatment using gentle forces to address the head, and also found that it had great influences on the pelvis as well.
Okay.
And we as his students and the students of his students, we've learned to take those principles that he outlined and apply them in many ways throughout the body. He taught some very subtle techniques or I shouldn't call them techniques because it's really principles and ways of gathering information and responding to processes, healing processes in the body. And those can be applied in the head and they can be applied everywhere else. So I don't really draw distinctions between cranial osteopathy and all of osteopathy because I'm using all of the same principles,
Okay.
whether I'm treating up here or treating in the foot.
Okay, so it almost solidifies or brings together the whole entire body, including the head.
It does.
Okay, and the fact that these bones in the head need to be actually almost moving, like there's the fluid type movement in between the parts of the brain, even though they come together like puzzle pieces. Right.
I think what Dr. Sutherland really articulated for us is that, and this was building on Dr. Still's observation, is that movement is an inherent characteristic of life and of health in the body, and that's one of the things that we're always assessing for, and that movement is also present and necessary in the head. It's a very subtle degree of movement. It's certainly not something like this, but it's an aspect of healthy function that helps in circulation, in normal sinus drainage, in nerve function, etc.
Okay, I'm just going to go a couple minutes over, George, if that's okay with you. Our cameraman, George, he's being good. Okay, Jenny, we've got about 5 or so more minutes. I wish we had about another hour. And you've been incredibly knowledgeable about helping people to understand what osteopathy is. So I'd kind of like to finish up this half hour by talking about what you do in this office and maybe the kind of patients that you bring in and why they seek you out.
So what I do in this office, it varies so much from patient to patient, which is what I really love about this job.
Okay.
It's endlessly interesting because I can have 5 people walk in with the same, medical diagnosis, and to me, it's a completely different picture because they're coming in with a different background, different lifestyle issues, completely different structural or body physical issues. So how they arrive at those particular symptoms, they may be manifesting in the same way for totally different reasons. And so for me, it's always a puzzle each time someone comes in and trying to figure out how the whole has arrived at this one particular place and what's the best way that I can work with them.
And that's where healing becomes an art.
Absolutely.
Everybody's different, and everybody is a unique individual biochemically, and so it makes perfect sense to me that you do that.
And so with some people I spend quite a bit of time talking about diet, or if they need a lot of help I send them to you because I don't go into the same degree of depth as you do in that regard. And with a lot of people, in the last few years in particular, I've really enjoyed bringing in aspects of movement and body education, drawing on some of the principles of teachers like F.M. Alexander from the Alexander technique, Feldenkrais, yoga and Tai Chi, which I studied for years and continue to just learn a great deal from. And
me too.
so I try to take everything that I'm doing in my life and learning from and find ways to apply that too with my patients. And I'm always learning from my patients too, to be honest. people come in and they have information from diverse sources. They tell me about websites, I write them down, and so I can pass them on to other patients. So it really is an interaction. And then in terms of the hands-on also, as I've alluded to, it's very much an interaction, because when I put my hands on a patient, watching my treatments, I often tell if somebody brings a significant other along who wants to watch, I warn them that it's frequently about as exciting as watching paint dry, because oftentimes I'm sitting there and it doesn't look like I'm doing a whole lot.
Exactly. Oh, yes.
And over the years, my style has evolved and continues to evolve. When I first started treating, I found myself using a lot more force routinely than I do now, and I've discovered that I can accomplish a lot of the same things with much less force oftentimes, although every now and then it helps to have muscles.
You know, you must have people often say after the treatment, "What did you just do?" You know, or "I feel better and I don't understand what you just did, but it worked."
And sometimes it can be hard to describe, because I'm not always entirely clear on what happened, because, which sounds silly, but it's because each interaction is unique. I'm not just applying a technique. There are certain principles and approaches I'm using, and finding points of balance in the tissues of the body, for example, is an important treatment approach, where I'm trying to create a neutral state where all of the forces are balanced, and where the person can more easily shift into a new direction and make a change. But that's always a change that the body is already trying to make. So I'm setting up the conditions for those inherent body forces that we talked about to shift into that direction of healing that they want to move into. So it's always an interaction. It's teamwork, as I tell them. And so I never know exactly what's going to happen. And sometimes it's very obvious to me what's changed and how. And sometimes it's rather mysterious, frankly. I tell medical students who I work with that all along through my training, my hands have been smarter than my head, which has been a really humbling experience for me, because I come from a pretty intellectual background, and it's been a real change of approach for me to let my mind just chill sometimes, because my hands know what to do, even though my mind is like, I'm not sure what you're trying to accomplish there, but my hands find that balance point and a change happens, and I can tell that, that there's greater health and vitality under my hands. And I'm not always sure how I got there, but a few years down the road, I start to understand that better.
Well, I understand that because being married to Jeff, I hear similar stories. And so this is a very gentle but powerful hands-on approach to healing. And so if you're interested in pursuing a different path of healing, and you would like this gentle hands-on approach, we are going to put this information up on our camera there so that you can contact Jenny if you want to. And I want to thank Jenny for talking to me today, and you're full of information. I mean, you know, Jenny is somewhat quiet if you get to know her, but all of a sudden when it's unleashed, there's a lot of power and information in there. You're like a little ball of fire. It's like, anyway, I really enjoyed talking to you, and hopefully we will do this again.
Well, this was really fun, and thanks so much for the opportunity.
You are welcome. Thank you.
My office is located in Plymouth. I'm best reached by phone at 603-536-4300. I'm happy to talk with you and answer any questions you might have. You may also check out my website for more information at jenniferhighlanddo.com.